Hey everyone, this is Dr. Alibhai here. We're going to be talking about scar tissue formation after a C-section. This is a really important area to address and was an issue for my wife after our first. And I wanted to show you an example using some paper here at the office. So if you imagine this is like the tissue of our body, nice and flat and ironed out there. What happens after the incision starts healing is it's become really crumpled, and you can see in here we have all these irregularities in the tissue, and this changes the normal function of the tissue, the motion, the way that it pulls and functions, and that affects the pelvis. It can lead to a lot of pelvic and lower back pain, and worse yet, the scar tissue that forms becomes really thick and ropey and maybe irregular on one side compared to the other. What we want to do is get our hands on it, and what you can do on your own at home is actually feel the scar tissue and look for the irregularities. You're going to actually feel for areas that feel a little more lumpy or restricted, and you can do something called the pin rolling technique, where you're going to actually pick up the scar tissue and start rolling and massaging it back and forth. You can do this up to 6 weeks of post-op, and we want to be able to make sure that we're getting some friction in the tissue. It may be uncomfortable, but every tissue in our body should be able to withstand a moderate amount of pressure. If it's tender, there's a good chance that there's a problem there that you want to start massaging out on your own. You can do some cross-friction work as well with your fingers, back and forth along the scar, to make sure that we start getting some proper motion through there. Again, if you get some subtle redness, that's normal, but we want to make sure that it's kind of staying below a 4 out of 10 in terms of discomfort. Doing that every day, because this keloid, this scar tissue, can form for upwards of 2 years. Again, if you got any questions about that, I definitely recommend you start getting in there and start massaging and getting to know that scar a little bit better. And let us know if you got any questions or comments. Take care.